Three principles are of utmost importance for maintaining asepsis during resuscitation or, for that matter, any invasive procedure. These are hand hygiene, identification of the sites and key parts, and aseptic non-touch technique. The importance and procedure of hand hygiene is described in a separate video. Key sites are susceptible patient sites including insertion and puncture sites. Hand is the key site. Key parts are the parts of the procedure equipment or medical devices that come in direct or indirect contact with patient sites. For example, during the insertion of intravenous cannula, the key part will be the tip of the intravenous cannula. The third principle is aseptic non-touch technique, which protects contamination of key parts and key sites from the health worker and the environment. During resuscitation, 5 steps are of critical importance from the asepsis point of view. These points are: entry into the newborn care corner, during a gastric or a nasal suction, during initiation of respiratory support, for example CPAP, during endotracheal intubation, during placement of an umbilical venous catheter and institution of intravenous drugs. The items required for neonatal resuscitation must be arranged in a working order before the delivery of the baby. While handling over orogastric tube, suction catheter, the helper strips apart the sleeve of the cover of the tube and the rescuer takes out the orogastric tube without touching the outside cover of the tube. For positive pressure ventilation, take autoclaved ambu bag, and the face masks should be cleaned with spirit swabs. Make sure that your laryngoscope's blade is already cleaned with spirit swab. Similarly, all items should be placed on the sterile surface, making sure that their key parts are protected. The warmer should be switched on, the baby bassinet should be covered with sterile sheets, and 3 sterile sheets should be kept on the baby's bassinet to pre-warm them. The next critical step where asepsis can be breached is endotracheal intubation. The key part in this procedure is tip of endotracheal tube. The helper tears apart the cover of the endotracheal tube in such a way that the hub of the endotracheal tube is exposed. Rescuer grasps the hub of endotracheal tube and takes out the tube from the sleeve, protecting the tip from coming in contact with anything. By this way, asepsis can be maintained during endotracheal intubation. One of the most critical steps during newborn resuscitation is securing an intravenous line. A third rescuer joins who has already performed hand hygiene and has donned gloves. Remember to use sterile gloves for this procedure. In this way, asepsis is maintained during newborn resuscitation. If you are able to do newborn resuscitation effectively, you can save many newborn lives.